Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Albert Chan. He's a cardiologist. Today's Kevin MD article is How to Beat the Five Devils of Modern Medicine and Live a Longer, Happier Life. Albert, welcome to the show.
Thank you for inviting me.
So let's start by briefly sharing your story and journey.
Okay, I was born in Hong Kong, came to this country when I was about 20 years old, went to a college and NYU Medical School. And after that, I was trained as a cardiologist and started practicing in New York State. Then I lived in what we call good old days many years ago. Then after a while, with all the HMO, everything kicking in, I was pretty fed up. So I decided to exile myself to Asia. So I closed my practice, sold it, and moved myself and the practice to Singapore.
Okay.
That's why I practiced there for about 15 years.
All right. You wrote this Kevin MD article, How to Beat the Five Devils of Modern Medicine and Live a Longer, Happier Life. And I think that's certainly informed by your experiences both in America and in Singapore. So tell me what you've learned. Tell me about this article for those who didn't get a chance to read it.
Okay. So I moved back to the US about 10 years ago. Again, try to practice cardiology and what we call preventive cardiology. Again, I encounter a lot of problems. The major problem I have is that I find out we as a doctors, we are trained to treat diseases, but we are not trained to prevent diseases. And that is the major problem. So after 35 years of practicing medicine, I decided to write a book to push for what we call PPPM, primordial proactive preventive medicine, to prevent the five devils, which are heart disease, stroke, cancer, dementia, and metabolic disease, including obesity, diabetes, and diabetes, and how to prevent them and how to, if you have it, how to reverse it.
And having practiced in both Singapore and the United States, did you feel that practicing in Singapore was more focused on prevention?
Yes. Now, one of the major difference between the healthcare system in Singapore and America is that 90% of the doctors in Singapore are primary care physicians. They either is a family medicine or internal medicine. So they only about 10% are specialists. In the US, it's the other way around. Most of us are specialists. We are trained to treat disease, but to prevent disease, the burden usually is on family medicine and the internists. But they only occupy very small percentage of the doctors in practicing in America.
So, speaking from the perspective of a cardiologist, what do you feel that physicians in America are lacking and not focusing as much as they should on prevention? What should they do more?
Like that is the whole thing, not just the doctor, it's the healthcare system itself. Let's say for me as a cardiologist, I'm a preventive cardiologist, but the patient I've been seeing, most of them are carrying the disease of the heart disease already when they come to see me, because they have a gatekeeper system. So everybody who want to talk about prevention about any major disease, they have to go to the family doctors or gatekeeper first. Only when they find they have a heart problem, then they get referred to us. So that is a problem. So I cannot practice preventive cardiology because they won't come to see me even before they develop the disease. And that's the major problem.
So, if these patients came to see you earlier on and you as a cardiologist is able to practice some prevention, what would you do?
Okay, there's a famous cardiologist called Dr. Valentine's de Fuster, which is the head of a Mount Sinai cardiology department. He did a major research to do the autopsy of the children or teenagers who die from a car accident. So from that study, they find out that the development of heart disease, which is atherosclerosis, the blockage of the artery, start as young as 10 years old or even 15 years old. So the major one is obviously is the bad cholesterol, LDL. But more than that is the accumulative LDL level. It means that not just being high, it's how long it has been high. That's how you develop a heart problem. So to prevent cardiovascular disease, basically you have to start the prevention at 10 or 15 years old, not until they're 40 or 50 years after they've had the first heart attack or after they have the symptoms. And that's a major problem. Yes.
So if you saw these people early on, 15 years old, what are some things that they can do to prevent any progression of atherosclerosis?
Okay, so in my book, I write out about 13 basic steps you have to do. Like how do you know about your cholesterol level? Again, one of the major misconceptions that people think they have a normal LDL or cholesterol level, and then they're immune to heart disease.
Mm-hmm.
But the problem is the normal level doesn't mean it's a healthy level. So it depends on your risk. So the major problem of the heart disease is you've got to know about your risk at any stage, any age. So you are trying to correct your risk factors and try to reverse it or even prevent the disease from happening. So that including diet, exercise, happiness, sleeping, inflammation, another new concept coming in. But a lot of them is to do with preventive medicine.
And in our healthcare system, even me as a primary care physician, what about our healthcare system prevents us from doing some of the things that you say?
Again, one of the major problems is that nobody care about you as a patient. In terms of the health insurance, they only care about their book,
Yeah.
how much money they can make. Even major hospital, they still try to, even they're non-profit, they have to make sure they balance the budget
Yeah.
to make money. So even the government may not care about your happy longevity. As long as you don't use too much money and you're quote unquote healthy, that's what they care. So to do that, you need to be proactive. You have to protect your own health and do something as early as possible. Nobody care about you. So at this stage, unfortunately, doctors are not happy, patients are not happy. So I try to promote a movement to promote happy longevity. Should be the goal for everybody.
So, what are some of the next steps to do that? So, if we were to make small steps in turning our health system around, what would you advise patients to do, and what would you advise doctors like myself to do?
So I promote the 4 steps
Okay.
about the happy longevity. First step is what I said, PPPM, primordial proactive preventive medicine. Know your risk, what we call risk stratification. At any age, you should know your age, even as young 20 years old or as so at 90 years old, you have to know what your risk to develop all those 5 levels at that stage. The second one, ideally, everybody should have concierge doctors to be their personal trainer for happy longevity. So they should know about the background, what are the problems are, family situation, financial situation, so that they can promote prevention or even they find some disease, try to reverse it. And then the third stage is called happiness enhancement. Because as I said, happiness engenders longevity. Longevity without happiness is meaningless. So
Mm-hmm.
even you can live at 90 years old, every day you're lying in the bed looking at the ceiling. And that's what we call longevity. It's meaningless. So you have to promote what you call, or you can seek health, happiness enhancement. People may think constipation is a problem. I got to solve the problem to have happiness. Somebody thinks sex is important. Somebody thinks sleeping is important. So that we should encourage a happiness enhancement for each individual person. Then the fourth one, actually is very important, it's called aging at home. So we find that people who end up in the nursing home or hospital most of the time when they get old, they lost a lot of years of happiness, not to mention even longevity.
Mm-hmm.
So people have to prepare to age at home. Even with all the AI technology, I think it's doable without much cost. But people have to prepare for it financially, how to buy a house, how to build a house, so that you can prepare yourself and your loved one to age at home. So those are 4 stages I promoted. Try to hopefully everybody can have a happy longevity.
So tell us a story, give us a case study. If you were to build our ideal health system that focuses on prevention proactively, what would that look like to you? Give me a sample case study, patient interaction that would be your ideal.
Okay, ideally, which I'm working on it, is how to get a clinic or a place that I can practice what I preach. So the ideal place is, first of all, somehow we can promote PPPM, preventive medicine. Everybody can have a screening to know where the risk is, the current risk. Again, have to cut down the cost, not an expensive test, but everyone should know where they stand at different stage. Second, hopefully I can promote some kind of personal physician system. People pay very little, probably a couple $100 extra per year, can get a doctor to take care of them for their whole life.
Mm-hmm.
Okay, it's what we call concierge doctor for personal training.
Mm-hmm.
The third one is a multi-specialty clinic who can solve your problem to promote happiness. Can be sleeping person, sex therapist, or dietitian, etc. So that you can refer you to them with a lowest cost. And then the fourth one, obviously, I hope everybody can prepare for aging at home. So hopefully that's what I'm working on. And as a matter of fact, I am trying to set up a clinic that we can practice all what I preach.
We're talking to Albert Chan. He's a cardiologist. Today's Kevin MD article is How to Beat the Five Devils of Modern Medicine and Live a Longer, Happier Life. Albert, let's end with some take home messages that you want to leave with the Kevin MD audience.
Okay, there are probably 5 take-home messages. First, in order to have a happy longevity, first one is do not die young. Sounds easy, but you have to do something to prevent death. Second, make sure that your loved one also don't die young. Okay, losing a loved one can lose a lot of years of happiness. Okay, the third one, do something about your risk. Okay, the fourth one, nobody care about you. You have to do it yourself. Okay, and the fifth one, read my book. Everything about happiness, happy longevity, evidence-based medicine, East Miss West. And there's a website called Happy Longevity, EBM.com. EBM stands for evidence-based medicine. So the website is Happy Longevity, EBM.com. And then you can get all the information.
Albert, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you for inviting me.